Good afternoon. Good afternoon, everybody, and thank you for tuning in again today. As a reminder, this week we're here every single day at 1 o'clock talking about school. A lot of questions. Sometimes it's very helpful to hear things more than once, so we thought we would have a brief conference each day at 1 o'clock. So I'm here today. I'll be here again tomorrow at 1 o'clock. Next week, we'll be back to Wednesday at 1 o'clock, just one day. Okay, so it's another good news day for the data. I ask you to please put the data up. Yesterday, we performed almost 8,500 tests. That's a banner day. Again, top of the nation in terms of number of tests, 8,500 tests. And here's the great news. We saw a percent positive rate of less than 1%, 0.7%. So that is 56 cases. And very sadly, another 4 deaths. It's the toll of this virus is just unbelievable and continues to take loved ones from us every day. So I want to begin with a thank you. You know, a few weeks ago when I was getting up here, we were getting nervous. Our cases were going up, the test positive was going up. And so at that time, we said social gatherings were going from 25 to 15, bars would have to be closed at 11, and we really ramped up our enforcement and around mask wearing. Cities and towns, thank you guys, ramped up enforcement of social gatherings, and you can see the results. The results are clear, and you see the good news story on your screen. So I want to thank the people of Rhode Island, thank mayors and town managers, thank the Department of Health. We need to stay at it, particularly now. Labor Day is this weekend. Don't party in groups greater than 15. We did that on 4th of July and we got into trouble. So start making your plans now for Labor Day. Keep it small. Keep it small, 15, not 20 or 25. Don't congregate, wear your mask, and keep social distance. We're on a good, stable path as we think about reopening school for our children. So let's stay there. Okay. Yesterday, we spent a lot of time talking about what would happen when we saw positive cases in schools, which we know we will have. And, you know, we've put a lot of time into obviously figuring out how to mitigate the risks so we have as few positive cases as possible. I want to thank all of our school leaders, principals, superintendents, teachers who are working so hard on their plans, doing great work, detailed work. I want to thank you. I would say I personally have seen these plans, have talked to superintendents, teachers, and principals. Your work is so impressive, so innovative and creative, and I want to say thank you. This is going to be hard to open school. No one can deny that. But I want us all to have a can-do attitude. We can do this. You know, 6 months ago, I didn't know what contact tracing was. We didn't know how we would possibly do enough testing to meet the needs of Rhode Island. How could we possibly, meet the needs of having enough N95 masks or enough testing or enough contact tracing? We were able to build a field hospital in 2 weeks. So at each point, when we put our mind to it, we, the people of Rhode Island, have risen to the challenge to do things that we thought were too hard to be done. We said we're going to do it because we have to do it. It's a crisis. And the same is going to be true for school. We have to summon that can-do attitude. Yes, it'll be hard. No one's ever done it before, but we're going to figure it out. And we're going to figure it out through innovation, collaboration, and a commitment to one another. That's what we've been doing all along. I'm going to try things, and if they work, we're going to share them. If they don't work, we're going to stop, and we're going to try something new. But I think we're going to surprise ourselves by all the innovation that comes out this school year, and we'll look back on it and say, I didn't think we could do that, but we did. And so I want to thank you, all of you, who have that attitude and have been working so hard to make school possible for students this year. So to that point, as I've gone through these plans and I have been so impressed with what I've seen, I wanted to just take a minute to walk you through what school might look like this year. For the kids out there, maybe there's some students listening, parents listening, teachers listening. Here's what it might look like. When you wake up in the morning, we all need to get into a routine. The first thing we need to do is check our symptoms. Wake up in the morning, how do we feel? Do we have a sore throat, a headache, a cough, etc.? Most districts are encouraging students and parents and teachers to download the Crush COVID app. So we have about 85,000 Rhode Islanders who have downloaded the Crush COVID app. If you haven't done that yet, I'd ask you today to please do that. It's probably the easiest way that you can keep track of symptoms. It'll also give you a push message every day to prompt you to check on your symptoms. So if you're a teacher or a student getting ready to go back to school, take a minute today and download the Crush COVID RI app. Anyway, if you're symptom-free, if you feel fine, you can go ahead and head to school. Transportation is going to look different. There will be school buses running, but at a very reduced capacity. So that means bus stops will have clearly marked waiting spaces to ensure social distancing. Hand sanitizer will be available, and students will have assigned seats on the bus. So for the kids out there, you have to sit in your assigned seat, you have to wear your mask, the windows of the buses will be open, and the bus stop will look different. Some cities and towns are getting creative. If you live in Smithfield, they're setting up walk zones to make it easy and safe for those who live close to the school to safely walk to school. All students will also get a health screening before getting on a bus. So you should be expected to do that. Just get yourself to know that before you get on the bus every day, you're going to be subject to a health screening. In Central Falls, that'll be a temperature check. So in many places, they'll have thermometers, they'll check your temperature. Other schools have other ways to screen your health. Drop off and pickup, if you drive to school, is going to look different this year. Please consult with your individual school for their new procedures around drop off and pickup. In Charahoe, for example, buses have different drop-off locations to prevent overcrowding. Almost every school, let me be clear about this, in almost every single school, there will be different drop-off and pickup systems this year than last year. And I just want to say, I know for parents and everyone, this is going to be less convenient. And so I apologize in advance for that. It's the way it needs to be to prevent overcrowding. We have to make sure that we don't have a lot of people bunched up close to each other for a long period of time. So if you help the school out and take a minute to understand what the drop-off and pickup procedures will be. Some places like Cranston getting really creative. They're going to have grab-and-go breakfasts as you enter the school so you can eat in your classroom. Also, in every school, they're going to have health checks. Some places it'll be a temperature check with a thermometer. Other places it'll be a screening. But we're just going to have to get used to this. Wear your mask to school. It'd be great, parents, if you could send your kids to school with extra masks. We'll also have extra masks at school if they don't have them. Hand sanitizer in your backpack. Just try to get into these routines. Once you're in your classroom, you'll have an assigned seat and you'll need to wear a mask throughout the day. Classrooms will have open windows, fans, and other measures to promote air circulation. In Jamestown, for example, there's going to be signage on the furniture and decals on the floor to remind you about social distancing, mask wearing, and washing your hands. In many, many places, you'll be having classes or lunch outside. So if you're a student in Little Compton, for example, you have access to multiple designated outdoor learning spaces, including several large event tents. So if you go to school this year and you see a tent outside, that's this normal to get through this year. You're going to be having class outside under a tent. After a few classes, it'll be time for lunch. Most students this year are going to eat lunch in your classroom with your stable group. So again, this year is going to be very structured. You're going to have a group of 30 people. You want to stick with that group in your assigned seats with the seating chart, eating lunch in your classroom. In some districts, like in Situate, students who order lunch at school will have it delivered to the classroom. In Foster, Gloucester, and Barrington, they're planning to eat lunch outdoors. Now, a question we're getting a lot from the kids, what about recess? Good news, there will be recess. Everyone needs a break, everyone needs a mask break, everyone needs some fresh air. So there's going to be recess, but even recess will be different. Like kids in Woonsocket, you're gonna be required to wash your hands or use Purell before and right after recess. When you're outside in your stable group, each student may have their own play equipment, like a hula hoop or jump ropes or balls, which is also what in Bristol Warren, they have some really creative ideas around how to make sure that kids can have things to play with, but they'll be all sanitized and will prevent infection from spreading. You also might have a schedule for when you can use certain parts of the schoolyard. At the end of the day, pickup procedures will look very similar to drop-off procedures. There'll be staggered times, separate entrances. This is, so get ready for everything to be different. Get ready for there to be glitches. Get ready for this to be less convenient. After we do it for a while, just like everything else, we'll get good at it. It will get easier, but it has to be very structured, and everything we're doing is to prevent crowding. We can't have crowded drop-offs and pickups. Finally, I just want to give one more reminder. It continues to come up. Here's the plan. September 14th is the first day of school. Except for Providence and Central Falls, every city and town has been cleared for full in-person learning. Schools will ramp up gradually between September 14th and October 13th. Now we're hearing from some parents, why can't we all be in school all the time starting September 14th? And I would say the reason for that is because, schools need a chance to slowly and safely bring the kids back. Everything is different this year. So while I realize it's inconvenient for those first few weeks to have it be staggered between in-person and virtual, and it's far from ideal, it should give you some confidence that we're using the time to get it right. And I would just ask you, please, parents, to be patient, as I know you are, with the principals and teachers. They need to figure out over those first few weeks how to safely bring back all the kids, and so we support them in that effort to slowly ramp up between September 14th and October 13th. Today at 3 o'clock, I'll be holding my weekly Back to School Facebook Live forum with Commissioner Infante Green and Health and Human Services Secretary Wilma Zeta-Jones and the Providence Superintendent Harrison Peters. The focus today will be about equity in education, focusing on the importance of in-person learning for everyone, but particularly for our youngest students, our multi-language learners, students with differing learning abilities, and others who are too frequently left behind. So I hope you will find the time to tune in today, 3 o'clock, Facebook Live. Next Thursday, now I have a special announcement right now for students. Next Thursday at the weekly forum, I'll be joined by Dr. McDonald and Barbara Cottom, who's the chair of the Rhode Island Board of Education. We're going to be devoting the entire session next Thursday to answering questions submitted by students. So later today, I'll be posting a link on my social media accounts for the students to submit questions. And we're going to send out that link today in the daily email. If you haven't signed up for an email yet and you have a student who has a question, sign up for that email at governor.ri.gov. So students, I know you have a ton of questions. Now's your chance. Ask us your questions and tune in next Thursday at 3 o'clock. Finally, I want to take a second to share some good news about unemployment insurance. Not related to schools, but very relevant. I'm very, very pleased to announce that starting today, we are going to be sending out the checks for the extended additional unemployment insurance. Between today and next Friday, everyone eligible for the additional up to $900 will be getting your checks. So I have to thank the hardworking folks at the Department of Labor and Training. We were aiming for next week. They beat the goal, as they often do. So if you're collecting unemployment insurance, first of all, I'm sorry, and we're going to work hard to get you your job back. But secondly, keep an eye out, because starting today through next week, you can look for the extra up to $900 in your check. Okay, with that, I'm going to turn it over to Dr. McDonald from the Department of Health.
So thank you, Governor, and it's good to be with you today. And I want to thank everybody for joining in. Following the Rhode Island story, I really appreciate people doing that. A couple things. 56 cases. I think highlighting the 0.7% positivity rate is important. My thanks to the healthcare providers. Over 8,400 tests yesterday, many in the rain. Can't thank the healthcare providers enough for what we're doing here, and it's just great to see it. It is amazing and humbling to be part of a state that's got such great testing numbers. And keep in mind, there is no cure for COVID right now, but there is case finding. There's case investigation and case isolation. That is the cure. That's why testing is so critical. And right now, 68 folks are in the hospital. 7 of those folks are intensive care unit and 4 are on a breathing machine. And I'm very sad that we lost 4 more of us yesterday. I really long for the day where that stops to become something we have to announce. It is still very tragic about each and every one of us that has passed from this time here, from this. There's a couple things I just want to chat a little bit with you about today. One is about how parents can help get their kids ready for school. And one is just how we can make kids safe when they get back home from school. And I think just some things to keep in mind is, it's that time of the year right after Labor Day. My brain is programmed from a kid to start school. And so this feels like the right time for me. But how you get to the bus is different. And one thing we're just keeping in the back of our mind is we haven't seen a lot of folks in 6 months. So if you're a little guy and you haven't seen your classmates in 6 months, it's going to be different, right? They're going to be taller. You might not even recognize them. You've grown too. This is awesome, and that's fine. So if you have to reintroduce yourself to a friend you haven't seen 6 months, that's okay. Hugging that friend, being within 6 feet, not the best approach. And I think one thing is, I think it's hard for kids to really relate to what 6 feet is, but most kids know how to jump. And if you can get to another kid within 2 jumps, you're too close. So just think about that. And I think as a parent, if I'm trying to teach my children what 6 feet looks like, I might take some colorful yarn that's 6 feet long, put that around the house or outside in the yard, and I might start illustrating what that looks like for my kids, because I want to teach them what being 6 feet apart looks like. I think as we enter school, one thing's keeping in the back of your mind, it's going to be different this year, right? In other words, how you enter school. There'll be signage. You're going to go in certain directions. You're going to follow people. We're not going to crowd up in hallways. That isn't what we're doing this year. I think other things as parents is make sure your kids have an extra mask. I would make sure they had one to keep at school. Every little guy might forget one once in a while. There will be masks at school, but some kids might have their favorite mask, have a cloth mask. I mean, I have a couple designer masks at home just because I find that interesting. But I think giving kids a little bit of freedom in that space might be kind of fun. I think other things is sending your little guy with hand sanitizer. If you have a little hand sanitizer in your pocket, you've got your own personal little hand washing station. And one of the key things for our kids is teaching them when you've touched an object that someone else touched, you should sanitize your hands. So there really shouldn't be passing of documents in school anymore or passing of objects. But if something like that happens, use your hand sanitizer. And for the older kids, if we could just role model for the younger kids, quite frankly, I think we've all realized this. We're all role models, whether we like it or not. We either role model health affirming behavior or role modeling behavior that makes the pandemic propagate. So I think it's just important to have that context there. Some other thoughts that I want to just share with folks is, I think it's important for kids to learn to talk about how they feel. You really want to check with your little guy every day. You feel okay to go to school? And that's not a new thing. That is a new thing for us, right? We're not used to asking that, but I think we have to ask our little guys, how do you feel? By the way, when they get home, I would ask my little guy, how'd the day go? You feel okay? Were people being 6 feet apart? Were people wearing those masks? Let's have that dialogue, make it normal for our kids. And I think another concept is sharing. We do want to teach sharing to our kids, but right now sharing objects in school isn't really healthy. So we really don't want to have people sharing lunches, we don't have people sharing masks, and that just isn't a good idea. So we have to tell our little friends, look, we're just not going to share things. And I think that's just an important concept. I think when we think about what home looks like, important around our house to clean the high touch surfaces. So any digital device, any remote control, clean those often. My son, Christopher, he's 17. Every day at noon, he runs throughout my house. I asked him to. I have to remind him sometimes, but he cleans all my doorknobs and cleans all my things. I decided to appoint him early in the pandemic, my family infection prevention officer. He does not disappoint. Why not do that in your family, I think other things is just role modeling, washing hands. And one of the things about washing hands, when I wash my hands, what I do in my mind is I assume there's virus on it and I need to wash it off. And that's a different mindset because it's not an absent-minded activity for me. Now it's a health prevention activity with purpose. And I think if you think of it that way, there is virus on me, I've got to wash it off. You're a little bit more serious about it. I think some other things to keep in mind is at home, why don't we open the windows? It's nice out. Let's get the windows open, get that air exchange going. Other things I think is when little guys get home, if they've been wearing a disposable mask all day, go ahead and have them throw that mask away when they get home. Let's have another mask for them for the next day. And there are some positive things about school that are going to start. And I think we just have to get back to what is normal, right? So what I'm used to is buying shoes, right? So that should happen. Go get shoes this weekend if you can, preferably at a Rhode Island shoe store. But there's other things that are going to be normal with school too. There's probably going to be homework, my friends. You can't stop that, right? Health department can't cancel homework, right? So let's just accept that's okay. It's going to happen, right? But I'm getting ready for school. So I got some things, right? Look at me, guys. I got my pencils. I got my number 2 pencils. I'm ready to go, right? But sometimes in school I make mistakes. So you know what I've got? I got my erasers. I'm ready to go, right? Because I'm getting stuff here. But even exciting here. So I was at Walmart last night. I'll tell you about this deal. This was something else here. Ready for this? 25 cents for a box of crayons. Boy, this brought back memories for me. I colored sort of inside the lines, my friends. Sometimes I did, sometimes I didn't. I don't really care how you color. I just think you should color. By the way, adults can color too. You know what? Have a little fun with life, my friends. But there's some really fun things to be excited about for school this year. And I hope you have time to spend some time with crayons and your pencils and get ready for school. I think there's some fun things going on here. And I think we just have to think about it from the big picture. There's an old expression. If we don't learn from history, we're doomed to repeat it. If we're not willing to live differently during this pandemic, we are doomed to perpetuate it. As a parent, I am teaching my kids how to live differently during this pandemic. As a parent, I'm asking you to just do the same with your children. Teach them how to live differently during the pandemic. That's wearing their masks, being 6 feet apart, hand washing. It's still a preventable disease, my friends. If we do those things, I'm optimistic about my future. Thank you so much, everybody. So I'm going to turn it back to the governor, and it's time for questions.
Governor, how much of the preparation that we're seeing right now is for the short term versus the long term? For example, outdoor lunches, so on and so forth. Are you sort of planning that, hey, look, when we get to flu season, we may have to shut down at that point in time. So let's get as much school in before we hit, I don't know, November, and maximize what we can right now before flu season. Is that part of the discussion at all?
It's not so much that, although we are thinking a lot about flu season. And in fact, next week, we're going to have some announcements around our plans for increasing flu immunizations. We really need everybody to get a flu shot this year. In any event, so yes, we're thinking about that. What we are planning for is now, for example, with the great weather, an easy way to have proper air circulation is windows. That's harder to do in the middle of the winter. So many districts now are placing orders for air filtration equipment to have it ready for when the winter comes. So we are doing a lot of that thinking. You know, it's great to have lunch outside now. It's harder to do that in December. So they are thinking of purchasing or renting trailers or trucks, et cetera, for when you can't use outside.
And who's paying for those renovations? Is that CARES Act money?
Yes, that's exactly what the districts are submitting. That's the $50 million that they're eligible for. So they'll, if they go purchase an air filtration, they'll submit their bills and we reimburse them for that.
Governor, as you highlight the work that I assume you think is good work being done by some of these districts with new protocols and with lunch and recess and buses, and you've criticized others, particularly Warwick, but they're all making their own decisions, and you said at this point you're not going to overrule them. Do you think this has kind of created a contentious and confusing atmosphere, kind of where some districts you're pointing out are doing the right thing and some are doing it wrong, when in the end it's up to them?
Well, I would say the overall atmosphere in the world right now is difficult, and that is no different than what we have here. I don't actually have the authority to overrule, as you say, what a school district or a school committee is, how they vote. If I did, I might, but we don't. So what we are doing is doing everything we know how to do to enable them to reopen. And, you know, that's kind of how we see it. So like the Department of Health, we're doing our job to tell them, do we think it's safe to reopen based upon their municipality? And what does it have to look like? And we're trying to help enable that. Having said that, parents do have certain rights, particularly parents whose students have special learning needs and they have contracts with, with schools, individual learning plans. And as a parent, I know I would fight for my kids, and I expect many of those parents will be fighting for their kids.
And I know you've kind of talked about this before, but we're still getting questions. A lot of people are like, the social gathering limit is still 15 people. You're putting teachers and kids at risk by sending, even if you social distance them, there's still going to be hundreds of kids in some of these schools. What's your response to that? And again, the continued concern from teachers especially.
Yeah, I'm glad you asked that question because it might be the most common question we're getting at the moment. And I would like the doctor to answer that from a health perspective. My answer to that is that the Department of Health studied this extensively and I'm following their guidance. So why don't you hear from him?
So, I think where there's been some confusion is I'm having a social gathering, a backyard barbecue. I'm having a party, I can have 15 people, why only 15? But at school, it's a stable group up to 30, a stable pod up to 30. So when we say stable pod, we're really talking about a group, but it's the same group every day throughout a school year. So everybody gets to know each other. They actually form a relationship with each other. They establish trust, they care about each other. And there's someone to actually enforce rules, a teacher, and maybe an assistant teacher. So it's a consistent group, it's a stable group. I think of it a little bit like a baseball team. They may come from different areas, but they're gonna be together every day. And the manager and coach will keep them well aligned, but it can be a larger group in that regard because we know what they're doing. They have assigned seats, we can track the movement, we can do contact tracing really easily. We can really keep track of the group. It's easier to keep track of the group, so the group can go up to 30. It doesn't have to be 30, so your classroom doesn't have to be up to 30. For a social gathering, a party, you might have 15 people, you may not know them well, they may not wear their masks, they may not social distance. We've seen a fair amount of that not happening is people not wearing masks and social distancing at parties. We've actually seen more outbreaks from backyard barbecues than we ever expected. And that's what really got us in trouble in many ways over 4th of July weekend. And I worry about that for Labor Day weekend, just so you know. Just in case you're curious, the McDonald family is not gathering as our clan like we normally do. We're just keeping in our own little groups because we just feel it's safer. So with social gatherings, it's not controlled. There's no enforcer. It's a whole different mindset, and that's where we've seen outbreaks. So to me, they're qualitatively different. And I hope that answers the question for folks. Thank you.
Dr. While you're at the podium, you cited the positivity rate of 0.7%. So that's based on the total test count, ignoring people who were tested for the first time. And going by the other measure, or the other condition, the positivity rate is closer to 2.2%. And do you feel that that's somewhat confusing? I don't want to say misleading, certainly, but confusing to cite those numbers in tandem or in opposition or separately? And separately on that point, later to the governor, should we choose to answer, have we gotten anywhere with Massachusetts changing their quarantine rules because Rhode Island has not exceeded their positivity threshold in weeks, yet we're still subject to quarantine out of state?
Yeah, so thanks for your question, and I do think it's confusing for people. Let me try to explain it the way I think about it. So 0.7% to me is a genuine statistic that we're reporting. And one of the things I just want you to think about is when you have a test, that just tells me at that moment in time, you don't have the virus on you. That's what it tells me. Why that's important is you might have been tested for X reason 3 weeks ago and you were negative, but I still need to test you now because you had a new reason to be tested. Whether it's because you're coming to college or whether it's because you were a close contact of someone, there's just a different reason. So our numbers are astonishingly low though, and I think that's just an important point. When we look at our incidence, what I mean by incidence is the number of cases per week and per day compared to other states, we're still doing way better than the vast majority of states in the country. And when you look at where the country's going with COVID, we're heading in the right direction here. And I'm going to say something I haven't said in the last 187 days. So I'm about to say something I haven't said in a long time. So in over 6 months, I've used this sentence. I am optimistic. And I know that sounds simple, but my friends, I have lived with this pandemic every day for the last 187 days like you have no idea. I'm optimistic about what I'm seeing right now because the fact, the governor highlighted this earlier, when the numbers went up a couple weeks ago, I was nervous and I was like, oh my gosh, we're doing all this testing. It's going to be a hot mess on our hands. But remember I said earlier, there isn't a cure right now, but here's our current cure. We have case finding, case investigation, contact tracing. This is really critical. And that only comes when you test people. So we're always one of the top 3 states that test people. And that makes me optimistic and we're persevering. I can't believe we did 8,500 tests yesterday. I remember being at a previous press conference when someone said, how do you possibly think you could do 1,000 tests a day? And I said, well, we think we're going to make it happen. We're pretty confident. And now we're blowing that out of the water. It really highlights to me a lot of what Rhode Island's done during the pandemic. Every time I just see the impossible in front of me, it not only becomes possible, it actually happens. I'm continually pleasantly surprised by how my partners throughout the state help us move this thing. So, to your question, I understand there's confusion, but I really think the 0.7% is a legitimate number and the number that makes the most sense to me. You had another question for the governor. Let me step aside, let her address that. Thank you.
So we've been working on this harder than ever because, look, Rhode Island tests twice as much as Massachusetts. We are testing twice as much as Massachusetts on a per capita basis. And the test that we're failing on the Massachusetts travel test is the number of cases per week. Now we're finding more cases per week because we're testing twice as much. And it's not a good strategy for us to test less or test less strategically in order to find fewer cases in order to get off the Massachusetts list. And our percent positive at 0.7% is far below the percent positive that they and the CDC recommend. So we have not yet prevailed upon the Commonwealth to change their rules, but we're working on it. because my argument to them is, we're your neighbor, we're a bordering state, we have a lot of interstate commerce, we have a lot of people who cross, I don't know what that was, a lot of people who cross boundaries, and I think it's different. So anyway, I think Baker's doing a great job, his team's doing a great job, they have an open ear to us. I'm on it, I'm pushing, I'm trying, but those are the facts.
When were you last able to talk to Governor Baker of Massachusetts about this? Because to be candid with you, Governor Baker's office won't even respond to my telephone messages and emails.
That I'm not going to get in the middle of, but we daily, constantly.
Commissioner, for parents who their children have to do distance learning, I'm hearing like Coventry, Warwick, is there some mechanism where at least the child could meet the teacher? Could you talk about the importance of, in the beginning of a new school year, for the teacher to meet their new students? Because when we went into the pandemic, that was March, it was the end, and they had known them. These are brand new for children to meet these teachers.
Yeah, so that's actually extremely important. And one of the things that we have been telling districts is exactly that. That's why transition grades were so important for us as we were moving forward in all the conversations, because it is going to be a new environment, new teachers. I think we had whatever success we had, or if we could call it that at that time, was because they knew the teachers, exactly what you're saying. So should teachers be communicating beforehand? Absolutely. Should be communicating with the parents too, so that there's some sense of ownership and being part of a class, because it is going to be different. So yes.
Quick follow-up. Now, yesterday we all learned about a horrific crime that happened in Providence with a 16-year-old girl attacked by 8 men. I've been told that it was a teacher that was supportive to that child to come forth and cooperate. And law enforcement told me many times it's teachers that see these children. Are you okay? What happened? You're falling behind. It just seems cruel that these children in certain communities will not have access to the teachers that play a big role in that.
So that's why we've been so adamant about getting kids back to school, right? It's not just the academic, but it's also the social emotional. This is the place that many kids get support that they may or may not get at home. So there are many aspects to an education. So that's why we've been really strong about this, it's really important for kids to have that. And they're right. Teachers play a big role.
Yeah, Tanya.
Tanya Signori from the Rhode Island Echo. To the doctor, when do you think we'll be able to see blood tests that will be able to tell if someone's currently COVID-19 positive? I'm not speaking of the antibody test, but I'm also speaking because there are people without school-age children that are watching today. So when do you think we'll be able to have blood tests, blood work, routine blood work that will show for COVID? And the second part would be in an effort to promote more and more testing, which is the goal. Anytime anyone gets routine blood work, for them to have an access to a swab. Okay, would you like an optional to get tested today for COVID? A lot of people get routine blood work on a yearly or twice a year basis, 4 times a year, and they always have the option to get tested for COVID as a way to promote more testing. What are your thoughts on all that?
Yeah, so Tanya, what I see in the testing marketplace is more antigen testing, which is not blood testing as much as nasal swab testing. And what I see is more of these same-day rapid tests. So what I mean is the Sophia Quidel test, the BD Veritor test, and the Abbott Binax test was just announced. And part of what I think is interesting about the Abbott Binax test, it's the size of a credit card. There's no machine involved. You take someone's mucus and you can get an answer within 15 minutes. I see that really taking over the outpatient marketplace. And I'm optimistic about that because one of the things we really need the pandemic to do is eventually return to the usual practice of medicine, where you can go to your doctor's office like you normally would, get a test. Because like we go to the doctor for strep throat, we get a rapid strep, it's done, we get that. I'm old enough to know when that wasn't even possible, by the way. Because back when I started doing this, a rapid strep test didn't exist. I am that old, thank you very much. To your other question about blood tests though, for antibodies, so that's interesting. One of the things we're looking at right now is antibody testing. In other words, did you had COVID? And then do you have something that's positive for what's called IgG? Immunoglobulin G is a little bit like in your computer, your hard drive, your long-term memory. And if you're IgG positive, what that implies is that your body has seen the infection and knows it's there. So if you are re-exposed, it's a little bit like having a suit of armor on. Your immune system takes care of it for you. So that testing is happening now. I think the question we're seeing is how to best utilize it, and does it really mean you have long-term immunity? There's studies going on. We are actually just finishing up with the CDC our own study on that. We're one of the 3 entities that did that. New York City, Detroit, and Rhode Island participated in that. Interestingly, I actually did it myself. I had the blood test done. I was negative. And that was exciting to me because it meant that my own personal infection prevention plan had been working. But what I also realized was, in order for me to be successful and not acquire COVID, the people around me all had to be part of my personal infection prevention plan. They were 6 feet away from me. They're wearing masks. So I didn't like get tennis elbow patting myself on the back, but I was actually extensively gracious and really thankful to the people around me because they didn't get me sick. And I'm a doctor, I still see patients. So that's pretty cool to me, you know what I mean? But I think you're gonna see more of this serology testing, which is what you asked about, becoming more commonplace. Abbott has a nice test, and I think that's got the EUA from the FDA. I think it's commercially interesting. I think you're gonna see people utilizing it. I think one of the things we don't know yet though is, does it mean you have long-term immunity? You know, one of the unanswered questions for now, it's interesting, there are some people who had COVID. They were positive, we know that, but their IgG is negative. So does that mean they had waning immunity, or does it mean that they didn't have it enough where their immune system actually got a big enough signal? So this is something that still needs to be answered. And there might be some people who had such a minor infection or asymptomatic that they were identified, but they don't have long-term immunity. This is part of why when I hear people talking about herd immunity, they're getting way ahead of themselves. And we let the science be the science and let us understand that question more thoroughly. Thank you.
On the flip side, on the flip side of what I asked before about this for the governor and Dr. McDonald, I guess, on the flip side of what I asked before about the stable, you know, the kids in school versus the social gatherings, people are going to hear what the doctor just said, where the case numbers are astonishingly low. Things have kind of dipped back down from the spike about a month and a half ago. Why not ease back up on some of the other restrictions like social gatherings that you kind of pulled back on during that spike? I know you extended the orders for the month, but some people are going to hear this and be like, why are the other things still so strict when you're trying to get kids back in school and the case numbers are low again?
This, you know, I mean, you asked the million-dollar question, because if we relax things, then we'll be in trouble again. I mean,
how good is good enough at this point? The cases are very low.
Yeah, so again, great question. I mean, this is what we do all day. This is the balance. Everything we do is a judgment call and trying to strike a balance. So 4th of July and the week that followed 4th of July, we got a little bit lax, you know, and I let the social gathering go up to 25, et cetera. And we started to feel uncomfortable. You just saw the cases going up, hospitalizations going up. We were on a trend where we would have overwhelmed our hospital system, which is why we had to cut back. So right now, if you look at our unemployment rate, how much our economy has recovered compared to where we were a year ago, balanced against our hospitalizations, we found a good balance. So I'm trying to keep it stable with that balance of getting as many people back to work as possible. You know, like in California and New York, you still can't get your hair cut inside, you can't go to dinner inside, we're allowing as much as we think we can allow to enable commerce, but we're in a comfortable place with it's all the metrics that I won't bore you with now, but that I'm up here all the time saying, you know, an infection rate of around 1, hospitalization steady. That's why we have had these metrics that we've been very transparent about. We could disagree about them, but they're working for us.
Governor, do you genuinely believe that sometime during your term, you're going to walk out on this stage or any other forum and say, look, I know there's no phase 4, but we've done it. We're fully reopened. I know there'll be adjustments, the new normal, et cetera. But do you believe that is, based on what you know internally, that we're heading in a direction where that is possible?
Yes, absolutely. You know, I have 2 years left, so that's why I'm so confident. If my term ended this end of this year, I might not be so confident, but I believe there will be a vaccine. Don't ask me when, I don't know when, but there, many companies are streaming forward with great progress. I think, look, based on everything I know now, I would say even by this time next year, we have a chance of being, to use your word, back to normal. I don't know. I certainly hope so. And that's what I think.
Yeah, Governor, unrelated to COVID, there's effectively about a week left in the exclusivity deal with Fortuitous Partners and the state of Rhode Island relative to the Tidewater Landing deal. Is there an announcement on that imminent? And given the, if you will, failure of professional sports to operate outside of what they call now the bubble, a in-person sports attendance experience, is it possible for it to go forward?
Yeah, I need to get back to you on that. It's interesting you asked because I checked in on this just the other day. It's our expectation that it is going to go forward, but I will have the Commerce Secretary call you today and get you the exact details on the exclusivity agreement. But anyway, yes, as far as I know, it is going to go forward. Thank you. Bye, thank you.